Homelessness and mental health. We've all touched this. We've been engaged in conversations in our community. John Snook's true passion has always been mental health reform. He champions this as an executive director of the Treatment Advocacy Center, widely recognized as one of the most influential mental health advocacy organizations in existence today. His organization's research on issues such as the criminalization of mental illness has reshaped the national narrative on the treatment of severe mental illness. Please welcome to the stage, John Snook.
Recently, my cousin had a stroke. She was 25 at her first job in DC when she felt a splitting headache and that telltale numbness. She was able to tell her coworker what was happening before she passed out. Now, many of you in this room are no doubt been educated about strokes. You understand that time is of the essence. You may have even heard the slogan, "Time lost is brain lost." And so my cousin was rushed to the emergency room. She had surgery, and a team was arrayed around her. Neuropsychologists, speech therapists, occupational therapists, counselors. The goal was to prevent brain damage and get her back to where she was, to help her recover. I'm happy to say that story has a happy ending. She's recovering, looking forward to a long and healthy life. That same week, Carrie McBride contacted me. Carrie's son also has a brain disorder. But the difference is in how our society cared for her son versus my cousin is why I'm here before you today. Carrie's son has schizophrenia. While he was at the University of Virginia, he began to have paranoid delusions. He was convinced that other students were following him, that his professors were conspiring against him. He called his mother, asking her why she had started to work with the FBI against her. Carrie was a career State Department employee, so the logic was somewhat there. Carrie was devastated. Science now tells us that Carrie's son was in the midst of a psychotic episode. And that psychosis is just as toxic to the brain as a stroke. But rather than array a team to help him, rather than get him urgent care, our system sets up barriers to prevent help. Carrie was told that even though he was obviously psychotic, even though he was hiding from the FBI, unless he volunteered for care, she couldn't help him. She was told, well, hopefully he acts out and he's violent, because then he'll get arrested and he'll get some help that way. Carrie's son deteriorated and eventually became homeless. And as you all in this room know, the conversation changes when you become homeless. Her son was no longer a promising college student at UVA with a medical emergency. He was a homeless man. And so the conversation became, well, he can't get treatment unless he's going to starve to death or freeze to death on the streets. It took years before Carrie was able to get him treatment. Once she finally was able to get him hospitalized, after a few months, she said it was like a light switch went off. He recovered, regained his insight, understood he needed care, and was able to participate back in their lives again. But he had lost years to our outdated system. Years where his brain was struggling with untreated psychosis. My name is John Snook, and I run the Treatment Advocacy Center. We exist to make his story the same as my cousin's. So how do we do that? How do we turn the conversation into incentivizing treatment so that we don't take for granted that there's just people on our streets. And I know you're frustrated. I know you see people every day who are obviously ill, that you don't need to be a doctor to understand that they need care, but they aren't getting it. Folks that are cycling in and out over and over again, not getting the treatment they need, but taking huge amounts of resources in crisis. And I know you're frustrated being told you just don't understand the homeless crisis. You just don't understand what needs to be done. So I would tell you, you do understand that we need to be treating that sort of person like it was a medical illness. So where do we start? We have to start at the basics. Unfortunately, our society didn't take serious mental illness seriously for a long time. As a result, we decimated our treatment options. We've lost literally thousands of treatment beds across the country. We have fewer beds today per capita than we did in 1850. But people don't stop getting sick just because there's nowhere to care for them. They fall to the systems that can't say no. Our homeless shelters, our jails, our emergency rooms. And if you talk to any law enforcement officer, they will tell you that they are overwhelmed by people with mental illness. In almost every state in the union today, there's more people with mental illness in a jail or a prison than there is in the largest treatment facility in that state. We did a study last year with the National Sheriff's Association. We found that police officers spend a fifth of their time and nearly $1 billion a year just transporting and responding to mental health calls. And I challenge you to find one police officer that says any of that money is well spent, that any of that is anything but a waste of resources. But unfortunately, our system has incentivized law enforcement to become our mental health responders. That's how we get these chronic cycles of people who, by no fault of their own, become homeless on our streets and can't get help. Law enforcement will tell you that we get called to the scene because the law says you can't do anything until the person's dangerous to himself or somebody else. And you stop to think about that. We don't do that with anything. You've probably all heard that people with serious mental illness are no more dangerous than anyone else. So why do we have a standard for care that requires you to be dangerous? Why is Carrie's son wasting away simply because he isn't violent? Instead, we should treat mental illness like any other illness and say, if you're in need of medical care and you aren't able to understand you need treatment, we're able to step in. That's what we do for any other illness, and that's what we should do for mental illness. We should eliminate that dangerousness stigma. We also have to change the incentives that allow serious mental illness to fall through the cracks. You all know this as well as anyone because you see the results of these disincentives. Right now, treatment providers aren't paid anymore to help someone who's seriously mentally ill, someone who's scary or dangerous that might make a headline. They don't get any more money to help that person. Our systems aren't set up to recognize that one person might go to the ER 17 times, the jail another 10 times, and bounce in and out of hospitals over and over again. It just isn't set up to prioritize that person's care. And as a result, we waste millions of dollars. In almost every city in this room, I can guarantee you there's at least a half dozen, if not 100 people that you're spending millions of dollars on every year without them getting any better. They're just cycling in and out of your most expensive systems. Thankfully, cities are starting to step up. In New York City, the public advocate recently announced a groundbreaking plan. The recommendations would completely remove law enforcement from mental health response. Mayor de Blasio announced a 30-day review after an incident of their most important program, Kendra's Law, which provides care to this most seriously ill population on a consistent basis. In San Francisco, Mayor Breed's Urgent Cares SF would introduce 1,000 more hospital beds to their system and revitalize that same program, their version of Kendra's Law. Even the federal government is getting in the mix. I don't have to tell you that the federal government simply didn't care about mental illness for decades. There's a host of examples, but the most important one is that for years, Medicaid was simply not allowed to pay for psychiatric care in a hospital. For no reason other than they didn't want to. Is it any wonder why we don't have any hospital beds left? But thankfully, at the end of the Obama administration, and then taken up by the Trump administration, there's been a change to that rule. And now the federal government will pay states to revitalize that treatment system, to bring community care and treatment beds back to where it should be. And I would tell every downtown association in this room that you should be demanding that your state go after that money. It's money to stabilize your system, bring people the care that they need, and treat mental illness like any other illness. Because the reality is, we're never going to train our way out of this problem, and we're never going to be able to house our way out of this problem until we help people get the care they need. So this change is called the IMD exclusion, and you can go to our website, treatmentadvocacycenter.org/IMD to get more information. There's a lot to do. We finally have the opportunity to make change. And I'm thankful for all of you for sitting in this room and listening, because that's how we get things going. Thanks very much. Have a great day.